You know, some people in the healthcare economic sphere came to me and once said, that they could reduce the amount of the GNP that we spend on healthcare very easily. I said, how? They say, don't give anybody any drugs, steak is really good, seatbelts are really bad, and when everybody starts dying at the age of 35, we're not spending money on healthcare anymore.
All right.
That's what I'm hearing.
And that's the well, that's not what I'm saying. That may be what you're
I'm
hearing.
just provoking you.
But that's the balance of healthcare when you're dealing with population dynamics. You know, our mission within managed care is to manage the dollars. We hold the fiduciary responsibility for healthcare. No one else currently has it for the most part. You know, if you're in a capitated circumstance and an integrated system, you may have it. But managed care's role is to say, let's spend the dollars wisely. Why are we doing that? Because the United States spends 2.5 times the average what the Organization of Economically Developed Countries spends per capita on healthcare. And it's you know, 17.8% of our GDP. It's moving towards 20%. It impacts us in ways that are not measurable. So we do this for a lot of different reasons, but one of them that we have to keep in focus, and this is why oftentimes health insurers are criticized, is they forget the patient in the process. We still have to remember what we're trying to do is provide for payment of healthcare services, not the delivery of healthcare services, just the payment of it, so that patients can live healthy, happy, and high quality lives.
If that's the goal, and if everybody is pulling on the oars as hard as they can to get to that goal, why has the prevalence of cardiometabolic disorders continued to rise?
Because we haven't impacted patient lifestyle.
And
I think
why not?
Our system is not focused today on the front end proactive component, which is health, wellness, preventative care. And frankly, we haven't incentivized patients appropriately. And I think we're starting to see that now. And my prediction is you're going to see a lot more of it coming in these next several years where patients' premiums are going to be affected if they don't participate in health and wellness activities, if they don't perform, you know, at the outset of their insurance, they don't participate in health risk assessments, they don't share information, see their doctor on their weight, on their blood pressure, on their cholesterol levels. We're already seeing large employers moving in that direction today. You know, it's that carrot and stick argument. But we're going to have to move in that direction. We're seeing it now, and now there's dollars on the table through healthcare reform that are promoting employers to take on greater activity.
So you're looking for a greater contribution for preventive strategies, screening procedures in the workplace and outside the workplace? Is that what I'm hearing?
We're trying to do things that engage the patient. Yeah. That's what's missing and continues to be missing is patients have been insulated from the true cost of their diseases. You know, because we have an employer-based healthcare payment system, they typically see somewhere between only 20 to 25% of the real cost of their healthcare. That's changing, and as that changes, that is starting to change some behavior. We have a healthcare system that's designed around acute care management, not chronic care management. So as a consequence, we don't put the resources into the very things that would help them achieve their goals. That too is changing because with Affordable Care Act, you now see as a preventive benefit, counseling, intensive counseling for obesity is now a covered free benefit.
But I want to take that and I take a flip look at this whole issue because obesity is a great example. We talked initially that obesity is the driver of this epidemic that we are seeing. Yet, only a year ago, the American Association of Clinical Endocrinologists defined obesity as a disease. We are still the only medical society who's defined obesity as a disease. So many other societies have not joined that. Not only that, if I, the physician, would write obesity as a code for managing patients, even today, I will not get paid. Obesity is not reimbursable by anybody. It's true that CMS...
My health plan reimburses it.
That's nice. It's true that CMS, I don't work with your health system, it's true that CMS now...
Is that out of choice, or...?
Well, you know, maybe
Come
geography. But it's true that CMS has now acknowledged 12 sessions of dietary help for people with obesity, and some healthcare will pay for surgeries. But at the large majority, we don't have prevention in healthcare. It's not only chronic care, it's prevention was not part of healthcare. We always would get denied to do preventive work. So once this will change, maybe we can change the nation. It has to start from the top.
Well, let me ask Dr. Calabrese, here's a real soft